These people are developing health insurance products. It's a product. They're marketing those products. Then we have to have all the people that decide what are different products, which one do you want to buy. Then you buy it. Then you need care. You got to figure out where can you get your care. Then you get your care. Who pays what proportion? This is an incredibly wasteful way to finance or administer health care. No other nation does it this way. What do we get for the $938 billion that we're going to spend over the next 10 years for health care? It's based on an expansion of Medicaid, and then mandating that people purchase private insurance if they don't qualify for public programs, and then using tax dollars to subsidize the purchase of that private insurance, so that's tax dollars going to the insurance companies. And then in exchange for that, the private insurers said they would accept regulation, right? Because they've done so well when we tried to regulate them in the past. If we look at, what's considered affordable, a $7,000 premium with a $2,000 copay, deductible, and then co-insurance, this is $10,000 out of pocket that you're paying just right off the bat. Those three things. And unfortunately, it falls into the initials ICU, which in the medical world stands for intensive care unit. So we're in a crisis, we need ICU. We, as a movement, must be independent of political parties. We cannot be allied to a political party, because when you do that, you subordinate their agenda to your agenda. So we have to be clear about what we want. And this is where education comes in. Education is so important because words get used in different ways. This reform was, PPAC was called universal. It's not universal. It's called guaranteed and affordable, but it's none of those things. So we have to be clear on what those things mean and uncompromising. We can no longer settle for reforms that we know don't work. We've got to push hard for what